2009, 2010, I was first diagnosed with scleroderma. I was also told that it could eventually develop into something that could be quite serious, affecting other organs over a period of time. Over the last 6-7 years, that's about, in 2000, I think 16 or 17, I started finding it hard breathing. But I was not on oxygen actually, so that's when I was diagnosed with interstitial lung disease, ILD. This is how the disease progressed over a period of 6-7 years.
Rohit came to us for his pre-lung transplant workup in Cleveland Clinic.
The example of Rohit is significant because he was quite ill. He was in India, and we thank him and his family also for trusting us with his health, that they traveled all the way to Abu Dhabi to seek a very complex lung transplant.
I work out of Bombay. I mean, I have my own company. We are, we're into home loans and loan against property. So life was good. Life was going well for about 5-6 years, but then eventually a little bit of infection here and there, was forced to start using oxygen. Over the last 3-4 years, things got really worse, and I've been on 24 hours of oxygen at about 4-5 liters. That's a very short and brief history of how things were.
So the rehab starts right after the patient enters the hospital, right before the surgery. We usually divide it into 3 parts. There is an ICU part, there is a ward, and there is a post-lung transplant workup.
When he came in already addressed, to keep the good oxygen saturation level, he needed 4 liters of oxygen. But because his lungs were sick, they were not capable to bring him more oxygen.
Because he has multiple conditions that make him a difficult candidate for lung transplant.
And his saturation, when we measured it during the walking, started to drop to 74%. And we kept increasing the supplemental oxygen, which we needed to give him through the mask, up to 15 liters. And the oxygen saturation was still 74, which is very low compared to normal one, and it can affect negatively all the organ bodies, mainly the brain and the heart.
Now his case is particularly challenging. Because of that, he was assessed in other centers and not considered suitable. However, with our expertise and experience, we are able to handle these difficult situations where the patients have problems with their lungs, with their food pipes, swallowing function, and so on and so forth.
He was for a pre-lung transplant workup with rehab. His condition was like whenever he will try to talk few words, he will go out of breath.
So prior to transplant, I was on 8 to 10 liters of oxygen, and I used to do 30 minutes of cycling. And there used to be spurts where I had to stop. So every 5 minutes or every 6 minutes, I had to stop because, of course, when you're on oxygen and you have a weak lung, your pulse is radiating, your BP is dropping.
We initiated immediately the pre-lung transplant evaluation, which we have a specific protocol, which tests and exams are necessary.
We're in a very unique situation where Cleveland Clinic Abu Dhabi partners with the National Transplant Organization, the Hayat organization, which is responsible for organ donation. It is important to highlight that each donor can save many lives, and it is our social responsibility to consider organ donation to promote organ transplantation and save many lives.
Fast forward post-transplant with Soumya, I was here at the physiotherapist clinic here. We did 20 minutes in one shot. Absolutely no issues with my pulse, no issues in me. It's extremely liberating. It was more like every step is freedom.
The most inspirational part was when Rohit walked all by himself independently without any oxygen need. And when we asked him, he said that life has given him another chance and he has got this chance in Cleveland Clinic Abu Dhabi. So I think that was a part in his journey which was worth remembering for us as well.
In Cleveland Clinic Abu Dhabi, nurses work with their patient in their most vulnerable moment. In this case, our patient was having a very complex transplant surgery. We are the steady presence that listens, explains, and advocates when everything else feels so overwhelming. Our role is not just to deliver care, but to humanize it. We make sure our patient feels seen, heard, and supported as they move through their illness and recovery.
Most importantly, every patient is assigned a dedicated coordinator and clinical team that support them throughout their whole journey. Our International Patient Office here at Cleveland Clinic Abu Dhabi provides a seamless, safe and compassionate patient experience from start to finish.